Abortion is one subject that has been a highly debatable issue all over the world. People look at it through the prisms of ethics, theology, society, and health. In India, abortion has important social and demographic dimensions, mainly because of our huge population. The Medical Termination of Pregnancy Act 1971 governs the rules and procedures for abortion in India. The Act does not allow abortion of fetus that is more than 20 weeks old unless the pregnancy poses a grave threat to the mother's life. Recent days have witnessed a slew of debates on whether this provision of the Act should be amended. The debate was sparked by one particular case where a couple approached the Bombay High Court seeking permission to abort their 24-week-old fetus because it was diagnosed with serious congenital problem. The case saw the entire country divided in opinion. The couple, however, lost the battle when the court pronounced that the abortion could not be allowed. Barely a week later, the fetus was miscarried. This has sparked an even greater debate. Welcome to Gender Discourse. The subject we discuss today is the Medical Termination of Pregnancy Act 1971 and whether the Act needs amendment and in what ways. And to discuss the same, we have with us in the studio a very distinguished panel of experts. Please welcome to the program Nandita Rao, who is an advocate. Sitting next to her is Dr. Sudha Sundararaman, who is General Secretary, All India Democratic Women's Association. And sitting next to her is Dr. Shweta Gupta, who is a consultant in the Department of Gynecology of Sir Ganga Ram Hospital. And we are also joined by Dr. Sushanto K. Banerjee, who is Senior Advisor, Research and Evaluation, IPAS India, an organization that works for protecting women's reproductive health. I'll begin the discussion with you, Nandita. The Niketa Mehta case decided by the Bombay High Court has become a cause célèbre in this whole debate on the right of abortion. The court refused to grant this right to the Mehta couple since the law as it stands, it does not provide for medical termination of pregnancy after 20 weeks. Now, do you think there is inbuilt lacuna in the Act and which needs to be remedied?
Yeah, I think it is problematic for any act to be to not provide for any scope in exceptional circumstances, such as if there's a discovery that the child is not going to be able to lead a normal life, or such as if some accident takes place after 20 weeks creating this situation. So every legislation which is on an issue where there are so many dynamics like childbirth should always provide for a proviso of exceptional circumstances and leave it to the good judgment of the judiciary to decide, because basically this is a protective legislation to prevent people from killing the girl child. That the moment you discover that this is a female fetus, you rush and get it terminated. But there may be other cases, and those people should not suffer because of this. So I think that it is problematic.
Dr. Sundararaman, I'd like to ask you, there have been demands from various quarters that this so-called cut-off period be extended from 20 weeks to either 24 weeks or 26 weeks, where it is whether the fetus is developed enough to be able to diagnose abnormalities which would probably, for instance, the congenital heart disorder, and which would perhaps be difficult to diagnose at an earlier stage. Do you think this would really help addressing the problem?
First, let me just say that I am not a doctor. I am just Sudha Sundararaman, and I am the General Secretary of AIDWA. See, this issue of 20 weeks and 24 weeks has to be seen in a larger context. And what is this larger context? See, it's not only that congenital fetus abortion is the issue. That was the issue at stake in the Niketa Mehta case.
Yeah.
But you have to look at that in a larger framework. And today the problem about abortion and medical termination of pregnancy is that safe abortion services are actually not available for a very large section of our population. So this question of congenital malformation and the identification of that in the fetus, etc., we'll have to really consider whether it is, of course the doctor here will certainly comment on that, whether it is all right for the health of the woman to extend that period from 20 to 24 weeks. Our own belief is that in many such cases, it could be highly problematic for the woman, and if it has adverse implications for the health of the woman, then that should be the deciding factor. And therefore, the law has to go along with that perception. So, we have to keep that very much in mind. Of course, people are saying that technology has advanced, etc. But we also know, and what Sunita was saying just now, about the fact that sex selective abortion is very much an issue, and the woman's right to abortion should not translate into a much higher degree of sex selective abortion. As it is, our child sex ratios are falling, and we cannot permit it to fall further. So, this is also the additional issue. So, the health of the woman and also the aspect of sex
Ms.
selection.
Sundaraman, what about the health of the child? What if the child is diagnosed with a certain life-threatening disability?
Well, it depends on whether, why is it that it could not be diagnosed at a slightly earlier stage, what is the, those are certainly, I think, medical decisions. But as far as this case goes, I think the judge was within his framework, because the judge can only decide on the basis of the law.
Absolutely.
So, the law has been very clear on this, and the law was made in a certain context.
Yeah.
Today we have to see whether that context has changed, and I would want to place that the context is a much larger socio-economic context. So, I would like to enlarge in the terms of this debate.
Yeah, Dr. Shweta, what in your view is the degree of risk to the health of the mother involved in performing the procedure after 20 weeks of pregnancy?
Yeah, as a medical professional, what I could say is that if we terminate the pregnancy at 20 weeks or we terminate the pregnancy beyond that, the mode of termination would absolutely be the same. The risk to the mother would also remain the same. So, the question which arises is that if this particular lady or any lady would have come to us before 20 weeks and we would have diagnosed a congenital anomaly, and the decision would have been to terminate the pregnancy, then why should a decision to terminate a pregnant woman with a congenitally malformed baby be deferred if she approaches us later than 20 weeks? Because medically we do come across many women who do not approach doctors by 20 weeks. Then there are multiple cases where the ultrasound may not be possible, or if the ultrasound is done, it may not detect an anomaly before 20 weeks, but maybe after 20 weeks it detects an anomaly. So, if our decision to terminate a pregnancy holds true for a pregnant woman with a congenitally malformed baby before 20 weeks, why should it not hold true after 20 weeks? When physically and mentally the process of terminating the pregnancy would be the same, and the risk involved also would be the same. If we broadly classify that anything which is before 3 months of pregnancy is a completely different issue, and any pregnancy termination after the 3rd month of pregnancy is absolutely, it falls into a similar category. So, your process of terminating the pregnancy would be the same and the risk would be the same.
So, it doesn't make much of a difference?
It doesn't make much of a difference. So, of course, in this case, if we have to completely understand that when we are talking of this case, we are talking of a baby, a parent's dilemma to have a baby who would need multiple surgeries or may not thrive after birth is a different issue. And I completely agree with her that when we talk of an MTP or abortion as such, it's a completely a larger framework, but out of which we have to select out our patients and cases completely.
Okay, so it varies from case to case. Then why such a hue and cry about this cutoff period of 20 weeks and extending it to 24 or 26 weeks?
Yes, because even if I say that we have multiple diagnostic facilities, but there would be certain cases, and as I've said, that certain patients may not approach you, may not reach a good center which has a facility to diagnose such anomalies or some kind of problems, could be later than 20 weeks. And every medical practitioner, every gynecologist will come across this situation in their practice.
Yeah, right. Let's go straight to Dr. Banerjee now. Dr. Banerjee, my question to you is, in India, of course, abortion is not a matter of only of law. Abortions take place in our country by the millions, and female feticide is notoriously widespread in the country. So, can only law effectively check the control of the practice?
No, surely not. That's why that I would like to start this discussion that Nikita Mehta's case is actually not a unique case or exceptional case. This line of case is actually happening in our society, but only difference is that this is first time in our front page of newspaper and in media, and that's why it actually opened all of our eyes that 1971 we have actually enacted this MTP Act in India, and after that in 2002 there is a little slight amendment, but 36 years actually we passed with this MTP Act. Problem is much broader than single issue that actually we are highlighting today. Problem is that law has been in law case or in almirah of library or only with few selected people, but still today 92% of women still do not know abortion is legal by any weeks, whatever you can say, and that actually gives whole arena of problem in the arena of public health. Still women feel that it is illegal, and as they feel it is illegal, they actually would like to go to unsafe providers to make it actually not open and not open to the community, the society, even within the family. And that actually creates a huge problem in India. If you really consider the demographic phenomenon of India, 6 million induced abortion happen each year, and around 2/3 of these abortions are under unsafe hand. That's why every year 15,000 women actually we are losing only because of unsafe abortion. Therefore, don't take it as actually a unique case of Nikita Mehta. Think that this is a high time that we should go back to our act and please review that how we can help this kind of issue and cases so that act doesn't force them to go for unsafe abortion.
Right. So you're saying we need to spread more awareness about the law, because there is of course a lot of ignorance of such a law even existing. Nandita, Dr. Banerjee just spoke of amending the existing law. Of course, most abortions taking place in the country are carried out under conditions that cannot but be unsafe, for they are taking place in villages where there is almost no medical aid. Should the relevant law not take this into account?
Yeah, I think the law is quite archaic. It has two very simple sections which are material. One is that before 12 weeks, one doctor has to opine that this abortion is necessary because it's a threat to a woman's physical or mental safety, and the other is that it's dangerous for such a child to be born or the child's health. The second is after 20 weeks, 2 doctors have to give this opinion, and in no other circumstance can you have an abortion. The second reality of our country is that there are no medical facilities. Children are dying of diarrhea after they are born. So, let's not live in a utopia or in a delusion that in a rural area you're going to find this registered medical practitioner who's going to have the facilities of a safe abortion, or that maybe there are 2 medical practitioners available in that district or that area. So clearly the legislature have no perception of what the reality of medical facilities in this country is. So naturally people are going to go to illegal people because they want the job done. After all, the woman is concerned with her own health. The second thing very quickly I'd like to add is, if the mischief we are trying to correct is killing of the female fetus, there must be some focus that if the child is diagnosed as a female, then the doctor who's committing the who's performing the MTP has to reassure himself that the woman is doing it by her free will. Because personally I think right to abortion is the fundamental right to every woman, because every woman has the right to control her own reproductive health.
Absolutely.
The thing that has to be secured is that people are not forcing her into abortion because it's a female child. And I don't think this act in any way corrects that mischief. It denies a woman her right to abortion.
Right. Well, it's time for a short break in the program. We are discussing the Medical Termination of Pregnancy Act 1971, and when we come back, we'll discuss whether abortion can be treated as a matter of feminine choice. Stay tuned.